A growing opioid crisis and harsh, potentially deadly conditions for people living on the street and in encampments, just some of the topics that are top of mind for Toronto's Board of Health as city officials look to create a new strategic plan for the next 4 years. Davenport councillor Alejandra Bravo is leading the charge on this new strategic plan. She joins us now from City Hall. Thanks for being with us today, councillor.
Thanks. Great to be here with you, Melissa.
Can you tell us about what the strategic plan will include and why it's such an important document for the city?
Well, first of all, we have to have a strategic plan in a local public health authority, but it's one of those situations where the last plan expired in 2019 because of the pandemic. It was extended. We need something to really reflect and guide the work. That's based on the conditions that we're facing now and some of the challenges that you were just mentioning. It's really a wonderful thing to come together and have a special committee of the Board of Health work on this together, and the committee deliberated on what to look at, what would be in scope. So together we decided that we are going to look at that vision, which is sort of the statement that tells us where we're going and how we know if we're succeeding. We're going to look at the mission, so how we get to that vision and that ideal place, the things that we do, the work that we do, and even the principles, sort of the values that inform the choices that are going to be made. So it's quite large in scope, and it's really crucial for this committee and for the Board of Health that we hear from the people of Toronto, that we hear from the partners that we deliver public health services or do public health advocacy with, and that this is really as broad as possible. So we're right in the middle of this important consultation process now.
Now, I did list through some of those issues, and as I was reading them, I was thinking, these are the things that dominate our newscasts almost on a daily basis. I wonder what the priorities are for you right now and maybe how they've changed in recent years.
Well, I think that, we think about the council declaring homelessness an emergency, a crisis in this city. That's a really important piece of it. We talked about the opioid crisis, but also the hunger, the cost of living and the impact it's having on families. The conditions that youth in particular are facing has been something we've talked a lot about, low rates of immunization, and at the same time, the reports that we've received at the Board of Health indicate that children and youth are really struggling with their mental health. A lot of the things that we end up talking about are the social determinants of health, the things that really make it possible to have a healthy life, and that goes from everything from, do you have housing? Is it affordable? Do you have enough money to buy food? Do you have the ability to get the services that you need? And so we'll be focusing on the things that actually prevent harm, the things that make us systemically able to have a healthier health outcomes, and make sure that it's actually fair, equitable across society, because inequality is really hurting people right now, and it is what you report every day on the news. Together, I think we can think about what it is that we're proposing for the next 4 years that's going to help everyone get behind a vision and a mission. That means every division across this city, and of course this involves the provincial and federal government as well.
And so much of that affects the most vulnerable living in our city too. Okay, public consultations were happening earlier this month. I wonder what kind of feedback you were getting and how you'll put some of that into practice.
Well, the consultation period includes a survey that's ongoing until March 17th, and you can go to that at toronto.ca/TPH strategic plan. But we did hear at committee from people that made deputations. People came and sort of used sticky notes if they didn't want to speak on some boards to give feedback, and also we received written communications. There's a huge concern around hunger, especially school nutrition programs, and making sure that we expand them over the summer months, because that's an important intervention for healthier outcomes for the population. We heard about the impact of noise as sort of an emerging issue in terms of its impact on health, and certainly the need to really resolve the crisis of affordable housing.
Certainly some big challenges ahead. Those are some major issues you're tackling there. Councillor Alejandra Bravo, thank you so much for your time.
Thank you.